Hello, everyone. Thank you for the introduction. NARA is an international nonprofit which was founded in 1976 by regulators and represents all human care licensing. NARA's vision is consumer protection through prevention, and our mission is to promote the health and safety of children and adults in regulated settings. It is with those priorities that NARA is a proud partner with and supporter of the Children's Environmental Health Network and Eco-Healthy Childcare. NARA is represented on their National Advisory Committee and also welcomes EHCC as a regular presenter and participant at NARA's annual international licensing seminars. As you can see from NARA's vision and mission mentioned earlier, protecting children and their environmental health is a priority. Our partnership and mutual support allows us to advance this through support and education of both providers and licensing professionals. Even when in full compliance with regulatory requirements, there may be more that you can do to provide a safer and healthier program environment for both children and staff. Thank you for joining our webinar today. We know that you're going to find this information relevant and beneficial.
Wonderful. Kathy, can you hear me?
Yep.
Great. All right. Thank you again for joining. My name is Hester Paul. I'm the National Director of the Eco-Healthy Childcare Program, which is a program based out of Children's Environmental Health Network, and we're happy that you're joining us today. So the overview for the next hour is to first tell you a little bit more about Children's Environmental Health Network, which is a national nonprofit based in Washington, D.C. The Eco-Healthy Childcare Program is a program of this national nonprofit which focuses exclusively on supporting and educating early childhood education professionals. So that's all encompassing of direct service providers, trainers, health consultants, nurse consultants, licensing staff, child care resource and referral administrators and staff, as well as quality rating improvement system staff. We're going to look specifically at ATSDR's Choose Safe Places for Early Care and Education Guidance Manual, and ATSDR stands for the Agency for Toxic Substances and Disease Registry. So the meat of our training today, or our webinar, will be focusing on paying attention to where child care facilities are located and what they might be near that could be problematic for children's environmental health. And then finally, we'll talk a little bit about who's coming together beyond what we're doing in partnership with NARA for this webinar to be able to promote safe siting across all different types of child care facilities around the nation. So looking at Children's Environmental Health Network, we are based in Washington, D.C., and we work very much with toxicologists, pediatricians, researchers, and leaders within the realm of environmental health and also early care and learning. And just to make sure we're all on the same page, environmental health very much means anything external to a human, anything outside yourself that could be impacting the health and well-being of your person or of the children you're caring for. So we want to think about what's being sprayed. Are there pesticides around you? What's the type of lotion that you're putting on a child or yourself? How is the air quality within your facility? Are you opening windows to ventilate? So we're thinking about how all of these various exposures could impact the health and well-being of a young child. And when we think about children specifically, we have to keep in mind that they're in that extreme phase of their developmental window or their developmental cycle where they're growing rapidly. And we can think of ourselves as an adult and how much we might change in 6 years. And then we think of a young child growing from the age of 0 to 6 years, and you can just quickly realize how much change is happening and how much is growing within their internal organs, within their cognitive ability or their brains. And for the most part, for adults, we do have to be concerned about different exposures to toxic chemicals, but we're not changing as rapidly or to the degree that a child is. So Eco-Healthy Childcare is a program specifically of Children's Environmental Health Network that focuses on protecting children and their caregivers from environmental toxicants. And I went a little quickly on an earlier side, but Children's Environmental Health Network in general, the organization, is working really at that intersection of children and environmental health. So the whole organization doesn't focus on child care, but just this program specifically. So everything that we follow is science-based. So again, we're trying to look at all the research, distill it down, and bring it to child care professionals in a way that makes sense. We try to make sure that any recommendations that we provide are either free or low cost, because we're aware there's not a lot of extra money within child care. And we're also making sure that these suggestions are realistic. We know that we can't go ask you to replace all the carpet in your house if you're a family child care provider, or all the carpet in your center base, because that's not realistic. But what we can do is be providing you with the best practices suggestions for when you are ready to make such a change. So the Children's Environmental Health Network has been around for 25 years. Eco-Healthy Child Care Program has been around since about 2008. And what we're doing here is trying to impart change however we can for the early care and learning world. So we provide free resources such as fact sheets and frequently asked questions. We have a 30-item self-audit checklist where child care professionals can go through and comply with at least 24 of these 30 best practice items to become endorsed. If you receive that endorsement, then not only are you receiving a certificate and a poster to hang up in your child care facility, but we are also putting your information on our website, which accompanies with a map so that parents and other child care professionals can go to that map and kind of see who are all of the endorsed eco-healthy child care facilities around the nation. We feel that that will hopefully bring excitement to the work, and it also acknowledges the good work that these child care professionals are doing that are going above and beyond the requirements provided by child care licensing regulations. It's also great for market differentiation to be able to set yourself apart from other child care facilities in your neighborhood. The staff of Eco-Healthy Child Care provide technical assistance via email or phone, and we also deliver training. So we have a 5-hour Train the Trainer curriculum that we've delivered so far in 33 states. Just this year we were in Colorado and North Dakota. We have an e-learning course that has been approved for adult learning clock hours in 48 states, and we conduct webinars such as this in partnership with other leading child care associations and organizations. So in looking at children specifically, we know that they're not just little adults. We know that they have different behavior than we do. They tend to put things in their mouths when they're discovering things to try to learn about them. We don't typically see adults doing that. We know that their stature is much smaller than an adult, so that the air quality that they're breathing in at the height of 2 feet is actually different than the air quality that we would be breathing in at a typical adult level height. We know that their behavior is different in how they discover things on the ground. So in the beginning, before they're walking, they're sitting a lot, they're rolling around, they might be crawling. And again, these are not behaviors that we see adults doing because of the different developmental cycles that we're in. So just as an example, if you think about, for any of you, those of you who are listening who have ever lifted up old carpeting before, you know it's kind of grimy under there, and that's regardless of how much time people have cared for the carpet and trying to vacuum it. The reason for that, right, is anything that's ever been sprayed in that room where the carpet is, it could lead to maybe household cleaners or fragrances eventually dissipating and falling down on the carpet. That in combination with dirt or dust that's been tracked in all kind of melds into this crud, if you will, underneath the carpet. And so if we just look at that primary example of where a young child might be spending time, that's going to impart their access to unhealthy air just because they're so close to that dirty carpet. So we want to think about the different behaviors they have and also look at proportionally the fact that they are eating and drinking more pound for pound than an adult does. And that's because they are growing so fast that they are actually breathing more rapidly, so they're bringing in more air into their lungs, and they're eating and drinking more frequently. And so we have to think about food differentiation, and making sure that we pay attention to what they eat and making sure that these nutritious things that they are being provided are healthy. Also, we want to think about their metabolism as not being as efficient as an adult, and that's, again, back to the fact that they are still in this extreme developmental cycle. Their organs are still developing, as we said earlier, and that is also inclusive of their cognitive ability and their brain development. What we have to think about is that early chronic exposures pose a greater risk. And so what that means is if they're exposed to toxic chemicals when they're young, we may not see the ramifications of those exposures until later life. So many years fall between their early childhood exposures and then later in life when you may see that they've been diagnosed with some type of disability or illness that could be related to many years previous when they were a young child. So children's environmental health and child care facilities, generally what we know is that the research shows that child care environments do contain contaminants that are linked to adverse health effects. So in other words, we know from research that if a child is exposed to pesticides or if a child is exposed to arsenic on treated playground equipment or if a child is exposed to lead through lead-based paint or water, then we know that that will ill affect the child in some way. And so we want to be careful and conscious of the exposures that a child has at home, at a child care facility, and in any place where they're spending a large amount of their time to live and play. We also know, like we just said, is that chronic exposures during critical windows of development could have a long-lasting impact for later in life. And so that what that means, again, is in this extreme phase of development in 0 to 6 years, we know that those exposures could be more profound or impactful to their later life and development. So we have to be super careful. I think one thing that's important or maybe resonates with people is that for a long time we had a lot of funding and focus on the environmental health of schools, and of course that's very important. But what we've seen in the last 10 years is that there's been more focus on funding and attention to early care and education, and that's because children are even younger and even more susceptible to the damages of potential exposures to environmental health hazards. So generally, child care has been overlooked, but what we're seeing is that there are greater and greater trends towards people paying attention to the early care and learning environments. And that's all inclusive of family child care, center-based, early Head Start and Head Start, preschools, daycare, however you want to coin it. We know that child care professionals are generally not receiving enough education or training about environmental health hazards in general and exposures. So we see that that's kind of our responsibility with the EcoHealthy Child Care Program is, again, to distill the research and bring it to you to make sure that you have the information you need to make the best choices possible in caring for children directly or in making sure that the people that you support, whatever your position might be as licensing staff or health consultant, so that providers that are working directly with the children have the resources and the information they need. Also, we need to think that any of these best practices or suggested advice is applicable in protecting the providers who are caring for the children. So if we look specifically at the population that hold these positions, we know that they are predominantly female. We know that they are predominantly young, and they are in the ages where they could be having their own children. And so we want to be thinking about potential in utero exposures as well as children who are already out of mom and, again, in those early years of 0 to 6. So now let's get a little bit more into the topic of safe siting. So we have our basis of environmental health and why we need to be concerned, but safe siting, in other words, is just really thoughtful consideration about where to locate an early care and education program or facility. So how I always start this conversation is thinking, okay, so is a child care facility close to a gas station? Is it close to a nail salon or a dry cleaner or a hazardous waste dump? These are all things that could be and are likely releasing toxic chemicals into the air. So they could be going into the air and affecting the air that's being breathed. Chemicals could be seeping into the ground and affecting the ground water that we're later going to drink. So we have to be conscious of where is the child care facility and is it being located in an area that will be safe for young children. Also, what we want to think is not just proximity to something, but what a building maybe used to be, right? So if it used to be something and then those people left and we have replaced that with a child care facility, we still have to think about the contaminants that could be lingering around in the facility that could be completely unseen. Maybe you can't smell it, taste it, hear it, but they still are there lingering, and they could be impacting the health and well-being of young children. So the goal of safe siting generally is to make sure that environmental health hazards are addressed, or so that we pay attention to what is around or what was in the former use of a facility, so that children are protected. So the Agency for Toxic Substances and Disease Registry is actually kind of an arm of the Center of Disease Control and Prevention. And what we want to do, what they're doing here is creating guidelines and a guidance manual to educate and support all of us in paying attention to the safe siting of child care facilities. So generally, the ATSDR is what I'll call it, is protecting communities from environmental health threats through application of state-of-the-art science. So again, everything is empirically derived. They're following the science. They've worked within 6,000 communities. And the reason that they came about creating the Choose Safe Places or Safe Siting program for early care and education is because early care and education sites were beginning to be identified as part of their general site work. So in general, they were looking around at protecting communities, and a couple things came up that had to do with child care facilities, and they ultimately figured, oh, okay, we really need to create an overall program and guidance manual to help all early care and education professionals be conscious of the fact that we need to pay attention about the siting of child care facilities. So again, we're looking at adjacent to sites or in close proximity to sites, and then we're also looking at what the former use of a site was. So Choosing Safe Places for Early Care and Education is the full name of this program and the adjacent guidance manual. It was launched in 2017 by ATSDR, so it's pretty new. And that's when they released this guidance manual, which can be found online, and at the end of the presentation we'll provide you with that link. And the overall mission for ATSDR is to ensure that early childhood and education programs are located where chemical hazards have been considered, addressed, and ruled out or mitigated to best protect children's health. And so some of the work that they're doing is funding has been provided to 25 different states, and those individual states are working over 3 years. Right now we're in year 2 to basically assess the lay of the land within their state, find out who's who, what's being done, and to ultimately come up with a program or an initiative to support and protect child care facilities from being in too close of a site to something that could be problematic, again, such as a dry cleaner or a gas station. As part of this work, some national partners, including Children's Environmental Health Network, the National Association for City and County Health Officials, and the Environmental Law Institute have been funded to support these 25 states in better understanding the nuances and who's who of the different leading child care associations, the platforms or the networks. So imagine that these 25 states are from health departments, right? And although they understand environmental health, they're still learning how does child care work. And for all of those of you that are in child care, you understand, okay, well, you have licensing over here. Each state has a quality rating improvement program. You have national accreditation, which is offered by a couple different entities, right? And then you also have voluntary programs. So we find that our role is to help guide them in understanding who's who with early care and learning, and try to support them in making programs or initiating initiatives that can be long-lasting. So why is location important? Well, historically, we weren't paying attention to where a child care facility was located. That's as simple as it is. So we weren't doing an environmental site assessment before a child care facility began. So we weren't looking at, again, proximity to what was close. We weren't looking at what a building historically was used for. And we weren't doing an environmental audit before getting your child care license. So historically, it just wasn't being paid attention to. In 2014, Congress passed the Child Care and Development Block Grant Act, which identifies minimum health and safety requirements for child care facilities receiving child care and development fund assistance. So that was a step in the right direction of paying attention to environmental health. And then in 2015, the Administration for Children and Families, or ACF, released Caring for Our Children Basics, which, as you guys may be familiar, that's pulled from the National Resource Center for Health and Safety in Child Care and Early Education, which is a set of voluntary or baseline health and safety standards for use across child care programs or Head Start. So we're seeing this trend of where we were paying attention more and more to environmental health, but generally still didn't have any specific program around safe siting. So we want to look at some examples as to why kind of this work resonated and why it's growing so quickly, why the importance is. So one example that you may be familiar with is the example of improper siting of a child care facility in New Jersey. The child care facility's name was Kitty College, and ultimately the child care facility was opened up in a former mercury thermometer factory. For those of you who aren't as familiar with the impacts of mercury exposure, you can kind of think about it as being mercury is bad for the brain. It kind of impairs our cognitive ability. It can reduce IQ. And so the fact that exposure to maybe a compact fluorescent light bulb that breaks or a mercury thermometer that breaks, that alone is problematic, and we educate through the Eco-Healthy Child Care program that that's something that we need to take very seriously. So you can imagine the magnitude of having children housed within a building that used to create mercury thermometers in general. So New Jersey's approach to dealing with this issue was basically to put in place a variety of legislative and regulatory reforms that were focused on identifying and addressing environmental contamination at a facility before it was licensed. So they kind of right away learned from this experience and got on it. And under New Jersey's current child care regulations, at the time of an initial application for license renewal, or for facility relocation, a child care facility must submit to the Office of Licensing an approval from the State Department of Environmental Protection, indicating that no further environmental remediation is needed for the site. And in general, it requires the facility kind of to go underneath a preliminary assessment. So ultimately, in New Jersey, you're not going to be able to go and have to get your license or renew your license or relocate your facility without having to pay attention to an assessment of the child care building. The last thing I would say is just that the child care center in New Jersey must certify in writing whether the building or house has ever been used in one of the following categories, such as like a factory, a high hazard, storage, dry cleaner, nail salon, gas station, or funeral home. So very much you can see that New Jersey, because of this incident, is leading the way for all of the rest of us to understand how important this work is and also how you can frame a system around child care licensing. So this is another example. And again, these are helpful not just because they're a little sad, but also to just put into context why this work is so important. So in the state of Wisconsin, a child care facility was co-located within a gas station and a store. So kind of think about just, like a shorter building, and they just had a gas station in one part, you have a child care facility, and you have a store. And what was happening is that the child care workers were complaining of a strong gasoline smell, which is not too hard to believe. And so indoor air samples were identified and collected, and basically benzene, which is found in gasoline, the concentrations were consistent or are consistent with an increased cancer risk. And so what we found is, okay, if you co-locate a gas station so close to a child care facility, naturally what you're going to see is some vapor intrusions, or basically what that means is chemicals coming from the gasoline that could be lingering into the air through the windows, through the air ducts, to what the people are breathing within the child care facility. It's also, there's a possibility, right, of a fire or an explosion hazard just being that close to gasoline. So ATSDR came in and basically recommended that the child care center relocate until action was taken to ensure that the vapors were not reaching the daycare facility anymore. So this is a helpful diagram to just help us pay attention to all of the various types of environmental exposures that we should be paying attention to. So just looking at a couple of them here, on your left-hand side of the screen, you see the children kind of playing outside, and that's where we want to think about, okay, what kind of dermal contact, like what could the kids be touching that might be problematic? We know chemicals can be absorbed through the skin, so just touch is a problem potentially if there are chemicals around. We also have to think about ingestion, so thinking back to those young kids and how they discover things and put things in their mouth or crawl around on the ground or put dirt in their mouths. We want to think about what chemicals might be on the playground or in the play yard that they could be ingesting or putting in their mouths. If we look near the bottom of the screen, we see site leaching. So again, what chemicals could be being released that could release through the soil and you see go in eventually to touch the waterway. If you follow to the right of the screen from the bottom, you see that that groundwater could later be being consumed, and so that could be an exposure point. So we want to think about how might these chemicals be actually leaching into the ground, might be eventually reaching our water, and then might be consumed later by somebody who's just drinking the water or making baby formula or cooking with the water. Another example on the kind of middle to right-hand part of the screen, the exposure point says something about inhalation. So that's an easier one to understand. If there's a factory, right, or a gas station that's releasing toxic chemicals, the exposure point would just be the children breathing in these chemicals either while they're outside on the play yard or potentially inside if it's all coming in through the air duct. So the national estimate of the problem of how many child care facilities might be in a situation where the location of their facility is problematic is hard to suss out. But what ATSDR has done using GIS data is basically look at the 2014 Homeland Security Infrastructure Program data set. So it's they kind of looked at data from a couple years ago. One thing to note is that the data set only included center-based child care facilities and locations, including schools and religious institutes, but they were not looking at group home or family-based child care. So think about this more for center-based stats and less about family child care. And they found that about of the 115,000 or so child care facilities, about 76% are around potentially contaminated sites. So before you stress and think that that's a high percentage, let me talk you through it a little bit. So we know that about 149 of those were co-located on a brownfield site. 490 of those were within 200 meters of a Superfund site. About 1,200 were located within a formerly utilized defense site. 70,000 were within 500 meters of a resource conservation site. So you can see kind of they detailed out the percentages that might be making up that total 76%. What we know, though, is that it's not likely that large of a percentage. We know that proximity does not always mean exposure to contaminants. And we also know that, again, that this data set is only paying attention to licensed child care facilities. So instead of assuming that 46% are actually in a situation where it's extremely problematic like we looked at before, what we know is 76% are potentially in areas that should be assessed. So for lack of better words, we want to be doing some kind of a site assessment or a preliminary assessment to just pay attention to whether or not that facility is located in a place that was formerly used for something else, or are they in close proximity to a potentially problematic site. So it's a place to start from, knowing that really you're going to dwindle down and find out that many facilities are fine and only some of them actually need remediation. Okay, so how can we prevent some environmental exposures? And let's look at some state examples. So instead of just being doom and gloom and kind of seeing what has happened, let's see how we can prevent some. So since 2007, some states have enacted approaches to help children. And we're going to look specifically at New Jersey, like we talked about before, and also Connecticut. So for New Jersey, again, we know that they put into place some actual licensing regulations. If the building was ever classified as a factory or an industry having high hazard or storage or dry cleaners, nail salons, or gas stations, we knew that they were going to require an indoor environmental health assessment performed by a licensing indoor environmental consultant. What we knew for Connecticut is that they created a state program that did not change the licensing regulations, and we're going to look at that again in a minute. So back to New Jersey, we know that they must obtain a site remediation clearance, right, through the Department of Environmental Protection before they can before they can attain a license for their child care facility. We know that they have to certify whether the property was housed using past uses that were concerning. And then in cases involving certain past uses, such as before 1979, a safe building interior certification might be required. So ultimately, they have all of these systems in place to assure that child care facilities are located in proper places, and all of that is taking place before a child care facility can actually receive their license. So for Connecticut, they're being done slightly differently. This is a non-regulatory approach, and what they're doing is actually conducting some screening. So they have the Child Daycare Screening Assessment for Environmental Risk Program, which people refer to as SAFER. It was initiated by the Department of Public Health in 2010, and ultimately what they do is cross-check a whole set of different databases for known environmental health hazards. The use of the child care application form to request information for potential site hazards. So if someone is applying for their child care application, this is a time when they are asked about specific questions, which will lead them to look into more what is happening in close proximity to their child care facility and what was the former use of the building. So forms and training for inspectors is being done in Connecticut to identify potential hazards. And also they have technical assistance for addressing and identifying hazards. So there's different staff that are very equipped to ultimately support through email or phone or direct technical assistance site visits in person the identification and the assessment of whether or not a child care facility location would be fine in Connecticut. The main thing, though, to remember is this is totally non-regulatory, and it's still an extremely effective system. So in New Jersey, we see that it's part of licensing. In Connecticut, we see that it's non-regulatory. But in both states, they've had a lot of success in just supporting and educating early care and learning professionals in paying attention to what's happening with the site of their facility. Other states, such as Pennsylvania, have actually also been developing voluntary initiatives. So if we look specifically at the ATSDR Choose Safe Places objectives, right? So now we've kind of gone through and said, okay, what happened historically and what's being done now? So again, in 2017, the Agency for Toxic Substances and Disease Registry created the Choose Safe Places guidance manual and started to initiate this whole program. Also, as a reminder, they had funding that they distributed to 25 different states, and those independent states are working right now. They're in year 2 of a 3-year grant cycle of basically creating their own independent program in their state for identifying and supporting early care and learning professionals. So the guidance manual is one opportunity that we have to research and access this information. They also are developing materials for how to build a program. And again, some of those materials are coming directly from the overarching federal agency, ATSDR, and some of those resources are being developed within these independent 25 states. They want to include safe siting considerations eventually at the licensing state level, which is wonderful. Obviously, we know that takes time. We want to include safe siting considerations in federally supported early care and education programs. And then we also want to implement safe siting considerations by accrediting organizations and large-scale operators. So looking at the National Association for the Education of Young Children or potentially the Association for Early Learning Leaders. Those are just 2 examples of national accrediting bodies where you can imagine that if they embedded some standards pertaining to safe siting, that is very much moving the bar forward as far as having people pay attention to safe siting in general. So the guidance manual explains the problem of why do we care about safe siting. It defines what safe siting includes, and I'm going to share that here in a moment. It explains the elements of ensuring safe sites, that sites are actually safe. It describes how you could build a program, and it contains program tools. And so all the 25 states are referring to this guidance manual and then moving forward within their own state to figure out what makes sense for them. But the 4 kind of key safe siting elements that are focused on within the guidance manual include the following. So paying attention to the former use of the site that might have left harmful substances, paying attention to the migration of harmful substances onto the site from other nearby sites, so nearby infrastructure, again, thinking about proximity, and then also the presence of naturally occurring harmful substances. And the last one is access to safe water. So if we look at these 2 pictures right here, on the left-hand side, you're seeing a brown, oh, sorry, can you go back 1 second to the, yeah, thank you. So the brownfield site in Massachusetts, this is just an image thinking about the soil and the groundwater contaminants. So it looks like a normal setting, right? You can't really tell. But when they did further research and assessment, they found that this was an area where they needed to pay attention to what was happening within the soil and groundwater. And on the right-hand side, this is a former mill located in Connecticut, and ultimately found that there were asbestos, mercury, and metal concerns residing within the building. And so these are the type of examples that are shown with, within the guidance manual for the past uses of a site, which may potentially lead to a problem later if you were to then use these areas for child care facilities. These are some examples of thinking about a nearby site. So again, the site that you choose for your child care facility could potentially be fine, but then we want to think about what's around. So something that I usually describe as an example is just thinking about Central California, right, where it's a large kind of booming agricultural area for our country. And if you have a child care facility that's too close to where pesticides are being sprayed for the agriculture, that obviously could be a huge potential problem for the health and well-being of children, looking at the indoor air quality of what's coming into the building. So on the left-hand side here, we're thinking about what are the pesticides that are being sprayed, and could there be potential kind of intrusion of those pesticides into the air quality of the children. And on the right-hand side, we're thinking about dry cleaning. And again, another example could be a gas station or a funeral home. So what is close to a child care facility might ultimately impact the environmental health of the location of a child care facility if we're not careful. This is a map of the United States looking at naturally occurring contamination. So this is something where we're not thinking about the former use of a site. We're not thinking about an industry or a factory or a business in close proximity, but instead we're thinking about what is actually naturally occurring. And so these are areas at risk of nitrate contamination to shallow groundwater, so might be potentially impacting what we're drinking or consuming. And if you look at kind of the graph there on the bottom, the red areas are high and the green areas are low. So you can kind of see in the central part of the United States is where we would be most concerned here about nitrate contamination. And again, we want to think about these things because we want to be careful of where we decide to place a child care facility. Access to safe drinking water was the 4th area that's focused on within the guidance manual. And the manual defines kind of different types of drinking water systems and also describes actions to ensure that each type of system is safe. And ultimately, we know, if you guys are kind of following the literature right now or the news, is that we're finding more and more problems with lead being in the water in our schools and in our child care facilities in general. So something we're focusing on with the ATSDR grantees coming up on a webinar is just looking at lead service line replacement and paying attention to how lead actually gets into water and how we can protect children from consuming water that might have lead in it. So how do you build a safe siting program? Again, this is going to look different for each of the 25 states that have funding, and we also know that some states that don't have funding are proceeding with this work as well. But we know some of the elements of a successful program are going to include obviously building partnerships. And again, that's where we find that our role is in really connecting these 25 states and the leadership of ATSDR working on this with kind of the who's who of early care and education. And obviously all of those who are affiliated with the National Association for Regulatory Administration understand that there's many different folks that come together, right, to protect children. And so we're encouraging them to connect with their child care licensing staff. We are encouraging them to connect with quality rating improvement staff, national accreditation, local health departments. So everybody kind of plays a role in paying attention to how do we all come together to create a long-lasting program. We want to identify problematic sites. We saw from the previous slides that could be done through licensing, and it also can be done in a non-regulatory way, such as Connecticut. We want to follow up effectively. So if something is discovered, how do we support that child care facility so that they can stay in business and also not stress out the parents, right? Is it something where we can support them while work commences and continues, or is it something where they would need to move the child care facility at least temporarily to make sure children are safe? And that looks back to the example we saw before where the child care facility was co-located next to a gas station. Finally, we know that we just need to provide education and outreach and awareness, and that's one of the reasons that we are offering this webinar, is just to make sure that early care and education professionals in general are aware of the concept of safe fighting. So looking at this diagram, I think it's helpful. It's also kind of a lot in the beginning when you look at it, but in the very middle where you see kind of that kind of yellowy box, you have the early care and education program. And I think the ultimate goal of this slide is to show you how many different entities are following this work or should be following this work and coming together in their own way within their own system to support making sure that child care facilities are located in a place that's safe. So on the top right hand of your screen, you have child care licensing. We've seen that they can play a key role in identifying different locations and making sure they're okay for children. We see on the bottom right, we have the Department of Health and Human Services and the Administration for Children and Families, so kind of federal entities. On the left-hand side in the pink reddish box, we have local health departments. On the top left, we have state health departments. So we kind of see here that it's all levels. We want the state to be involved. We want local health departments. We also need to make sure that we're tying in with constructs that are already understood and kind of respected for the world of early care and education, and that would lead us back to the child care resource and referral agencies. And to that point, we're putting on a similar webinar to this one in partnership with Child Care Aware of America next week, and that's because we know that that entity as well needs to be well-versed in what it means to choose safe places or have safe siting. So looking at some program successes, just to tell you that all of this, is worthwhile and makes sense. The Connecticut program, again, the SAFER program, this was the non-regulatory program. Since 2007, they actually honed in on 46 potentially problematic sites that were referred to by the Department of Health, and they found that only 10 of those sites required additional data, and only 5 of those sites had contamination that did require further action. And so this is where I want to highlight, if you were paying attention to the earlier slide where I said, okay, well, we're assuming 76% of child care facilities might need to be assessed, or they are in areas that could be problematic. We don't believe it would be a total of 76%. We know that once you're looking at the numbers, it very much can be whittled down to a smaller amount, and this is a primary example of that. So of the 46 potentially problematic sites, there really were only 5 that had contamination to the level of which action was required. So as a success story example, this was in Connecticut, and ultimately there was a business and a child care center that were next to each other. Both of them were on former agricultural land, and the business's property was part of a state-regulated cleanup program, but the next-door child care property was not. And so if the SAFER program had not existed, it could have been a potential problem for this child care facility. But because the SAFER program existed, they basically identified that the child care center might have a problematic exposure as well, which is not too far-fetched if you know the next-door business has a problem. Testing did find that arsenic was present in the soil. And ultimately, the contaminated soil was removed and replaced with clean soil. And so that's just a success story to show you it wasn't that huge of a deal, right? And it was something that was easily taken care of, and now everyone can sleep better at night knowing that the soil was removed and the children won't have exposure to arsenic. So in year 2, remember this is part of a current 3-year grant cycle where 25 states have funding. Right now, what EcoHealthy Childcare is doing is providing partner support for technical assistance to states. So, they can call us up and talk to us, and we try to help them in understanding the nuances and the systems of childcare. We are actually working with the National Resource Center for Health and Safety in Childcare and Early Education to update and make more comprehensive their standard pertaining to environmental audits. That's 5115. So we're going through and making sure it's more reflective of this best practice advice that's being provided through the guidance manual. EcoHealthy Childcare has created a safe siting frequently asked question, and we're in the process of finalizing our fact sheet. So those are free resources that will be distributed to childcare professionals so that they can better understand the importance of safe siting. We are doing some training. So Kathy was a couple weeks ago in the state of Colorado and delivered a 5-hour training, and most of the participants were licensing staff, and the last 20 minutes of that training pertained specifically to safe siting, and we partnered with representatives in Colorado to conduct that portion of the training. We have our e-learning course offered through EcoHealthy Childcare that doesn't cover safe siting, but it provides a 3-hour course that focuses on environmental health exposures within early care and learning environments. And so we find that e-learning course is very helpful to these state health department folks as they're reaching out to people, because if someone doesn't better understand environmental health for childcare, it's kind of a second step to then better understand safe siting. And then also we're doing joint conference presentation in coordination with partners. So the National Association for City and County Health Officials and ATSDR and the Children's Environmental Health Network are co-presenting with some Department of Health folks at the National Environmental Health Association conference for sure, and then we're waiting to hear whether or not we've been accepted at the American Public Health Association conference and the NARA conference coming up. So these are some of the web links that would be helpful to you. And again, a recording of this webinar in addition to these links, I think are what would probably be most helpful, but you're welcome to contact us directly, and I'll share my contact information in the next couple of slides. But here is where you can find access to the actual guidance manual. They also have kind of a one-stop shop fact sheet, so that might be something you could distribute and hand out to your colleagues. There's an interactive web-based tool that helps folks kind of better understand setting up safe places. And then there are also some videos that are pretty short and very user-friendly. So kind of depending on your learning style, there are various modes of accessing this information. So this is contact information for the Agency for Toxic Substances and Disease Registry. And also when you click onto the Apple Tree program at the very bottom, that link, easily there you can find a map of the states. And again, many states that aren't funded are working towards these efforts, but if you're in a state of one of the 25 that's receiving funding, then I would encourage you to kind of connect with them and just see what they're doing and see how you might be able to help within your current position. And this is my contact information, so I welcome you to email us any questions that you have. I also just want to remind you right now, if you have questions, please put those in the chat box because we're going to open it up and see if any have come through that I can try to answer for you. And Children's Environmental Health Network, if you're interested in just accessing EcoHealthy Childcare free resources or information, we have provided our Facebook link there and as well as our web link. And so Kathy, I'll just hand it over to you to see if we have any questions.
Hi, Hester. I don't see any questions yet. So if folks want to type their questions in the chat box, just feel free to do that right now. We can start answering some of those. Okay, so someone is asking about getting a copy of the presentation, and so I think, Hester, we're going to, NARA is going to be putting a recording of the webinar on their website, and I think we might also email folks a link to the recording as well. So, and we'll also include slides too. And then someone else has a question about finding out what states are participating in the apple tree.
Yeah, you know what? I can try to find right here the list and read them off for you guys, but otherwise, right when you click into the ATSDR website, you should be able to see a map that provides that information of what states are involved.
Yeah, and I just put up the slide that has that link, the Apple Tree Program link, and if you just cut and paste that into your browser, you should be able to pull that up real quick. Okay, I don't see any other questions.
Jim, was there anything further that you wanted to share before we close out?
No, thank you, Hester, but thank you everyone for joining the webinar today as well. And we'll get that information up on the website just as soon as we can.
All right, thank you for joining. We hope you found this helpful. And again, you'll be able to access the slides, and we will make sure that we share the PowerPoint. And when we share that email, Kathy, maybe we could just list out the 25 states that are funded.
Sure, definitely.
Okay. All right, thank you very much.